Hello, my name is Dr. Samantha Smith. I am a physical therapist that specializes in knee replacements. A really common question that you guys have is, why does my back hurt? My IT band, sciatica, things along that nature. You're starting to get other pain that's popping up after surgery, and you're wanting to know why it happens, first of all. Second of all, of course, you want to know, how can I fix this, or how to reduce some of that pain going forward. You're already dealing with the knee replacement pain, and on top of that, you're having the sciatica, the hip pain, the IT band is flared up. So I'm going to give you some exercises, some stretches that you can try, maybe run them past your physical therapist if you are working with one right now, to kind of give you some relief, and also kind of tell you what's going on and why they are flaring up like this. So before we get started, stay with me here. Please join my Facebook group if you aren't in it already. It is a Facebook support group that I participate in, and I can answer your questions in the group. I'm in the group more often than I am here on YouTube answering comments. So please join the Facebook group. There's tons of other people in the group too that you can relate to and kind of tell your story to. You'll realize really quickly that you are not alone with the majority of your symptoms. So Facebook group is called Succeed with Your New Knee. Just go on Facebook, type that in, you'll find the group. Second thing, stay with me here. Look at my website, succeedcourses.com. I have a ton of blog articles on there. And then if you're struggling with your physical therapy, you're struggling with your recovery, please look into one of my courses on my website. I have a 5-star review. I've had hundreds of people take these courses. They're doing so well with their range of motion, their strength, their pain, swelling, etc. So please look into those if you're struggling. You do not need to struggle with your knee replacement. It does get better if you have the appropriate rehabilitation program, a good physical therapist to guide you. So that can be me with one of my courses. Okay, let's get into some of the stretches and exercises that I can show you to help you with all these pains that we've been talking about. So right after surgery, you are not going to have full range of motion. Most of you are going to have, let's pretend this is my surgery leg. You're going to have a little bend in your knee. You're going to be walking with the walker. You're going to kind of be, you're hobbling around a little bit after surgery. You just had surgery. You have a painful knee, and you're trying to, work on the knee range of motion, strengthening. You're swollen. Lots of stuff going on right after surgery. So because your knee is not straight, you're walking like this, it causes a lot of tension on the hip and into the back. Also the SI joint, which is right in between the pelvis and the sacrum right here. So there's a lot of shearing forces. So your pelvis is here, your sacrum is here. It causes a lot of force, which we call shearing forces in physical therapy language. So if you can imagine, here we are with our bent knee. You're walking like this. You see, I'm going to exaggerate here, but you see how my hips are kind of swaying a little bit because I have this funky walking pattern right now. That's going to cause a lot of the hip pain and a lot of the back pain. It just goes what we call up the chain in physical therapy language. You're also going to get pain down the chain into your ankle as well. This is all normal, but of course, we don't want you to have this because it's limiting your physical therapy, your sleep, your function in life. It's very draining. You're already dealing with the knee replacement, and then you have to deal with the back as well. We do not want that. So long-term solution to this is to get that knee range of motion right away. A stretch I like to do pretty quickly after surgery, maybe if you're around 3 or 4 weeks post-surgery, it's called the runner's stretch. And I've talked about this before. If you guys follow me on Instagram, TikTok, etc., this is the runner's stretch. You are stretching that back of the knee. You're stretching the calf. You're stretching that hip. This is a really relieving position for people because you've been walking like this for so long, maybe 2 or 3 weeks now. And our normal walking pattern looks like this. Watch how this leg goes back. You see how that leg is back compared to this leg? That's that stretch that we're going to get into. Look at how my leg is back. That is really relieving to the hip, to the back, also into the ankle. So this is called the runner stretch. What you're going to do, grab a chair, grab a wall, your kitchen counter, lean up against it. You're going to get into a lunge position. One leg is forward. Your surgical leg is going to be behind you. Keep your toes facing forward, your hips turned forward as well. Upright posture. Just use the counter, the chair, the wall for balance here. Hold the stretch, maybe 15 to 30 seconds. You might not have this much, range of motion as I do. You might be more like this with your stretch. That's okay. Just do the best you can here. This is a great stretch to relieve some of that back pain, some of that hip pain. So that's number one that you can try. Another stretch that you can do, and you're going to need to be able to lay down with this one. Let's try it out. Okay, I'm demonstrating this on the floor, but feel free to use your bed or your couch. I don't expect you to get on the floor 2 or 3 weeks post knee replacement surgery. So if you're having that IT band pain, you're having the pain up here, maybe it's going down into the side of the knee, try this stretch. You're gonna get some sort of rope tie. This is a robe that I have. It's a rope tie. You can get a dog leash, a belt, a scarf, a gait belt, anything you got that's long, because you're going to put it around your foot. Okay, and then we're going to lay back, and the foot's going to go up, and you're going to lean it over to the side across the body. Okay, and you're going to use your hands to hold this position. The more intense the stretch is if you go towards the other side and really cross over the body. So I feel tension right away in my IT band. You can go all the way across the body if you can tolerate it and really stretch out that IT band. Okay, so that's a great stretch for the IT band. Also the back, this feels really good. Stretching that hamstring up this way is really helpful. If you're flexible, you can really pull that leg towards you and then bring it out to the side to really get that IT band. You might not have this much range of motion, although some of you ladies are really flexible. You guys are more flexible than I am. Some of my patients who are, in their 70s or 80s can really bring that leg all the way towards them and over to the side. So just do what you can here. But this is a great stretch. Hold it, 15 seconds or so, then bring it back up. Bring it back over, really stretch that IT band. So that is a great stretch for you. Okay, let me show you another one for the IT band. So if you're having the IT band tightness more in the side of the knee, kind of up this way, you can try a different type of, it's not a stretch, it's more of a massage type of activity. So I'm going to use a dumbbell. This works just fine. You can also use a rolling pin. A foam roller works really well for this one, but all you're going to do is roll the dumbbell, the rolling pin, the foam roller up against that area and just go back and forth. So you kind of have to get into a position like this and just go side to side, right in that area where you feel that tension and tightness. Sometimes this is all you need to relieve that pain. Just that little bit of massage is really, really helpful. And also tell your physical therapist, if you're working with one, hey, my IT band is really tight. Can you do a foam roller on it? Can you do some massage? See if that really helps. But that is a great way to relieve some of that IT band tightness. Lastly, a lot of you guys have sciatica or sciatic-like pain going all the way down the leg, kind of shooting down the leg. The biggest piece of advice that I give my patients is find a position that decreases the pain. So if you like laying in bed in kind of like a fetal position and that feels good on the back, do that periodically throughout the day to relieve some of that sciatic nerve pain. If you like laying on the floor, on your side, or any position that you can think of that relieves that pain, that's going to help the sciatic nerve calm down a little bit. If you keep irritating it with positions that are irritating over and over and over, it's just going to cause more inflammation and more pain. So pain and inflammation just feed off of each other. They're a vicious cycle. You have to stop it somehow. And the best way to stop it is just to find a position that can relieve some of that pain for you. So if there's something that helps, do that position. That's a great piece of advice for you. Another stretch that you can do for sciatica, these are called sciatic nerve stretches. So if you have the sciatica on this side, on your surgical leg, you're going to get into the slouch position. You're going to sit at the edge of your chair. You're going to slouch down with your chin tucked, and you're just going to kick the leg out in front of you. Just like this. And that is going to stretch the sciatic nerve. You have to get into the slouch position because we're tensioning the nervous system. We're tensioning, or sorry, not the nervous system. We're tensioning the spinal cord, part of the nervous system. We're tensioning the sciatic nerve too, and then kicking it up and down to kind of what's called nerve flossing, or just like a nerve stretch to kind of loosen up the sciatic nerve. That might or might not help. Anytime I've had sciatica, the best thing for me to do is to keep moving, keep walking, and find those positions that relieve the pain. But try not to just sit all day. That also could be causing some of the sciatica. Work on those runner stretches. Really work on your range of motion of your knee to help the issue in the long term. Hopefully some of those tips and tricks are helpful. Please let me know. Join the Facebook group. Post below this video in the comments. Let other people know kind of what has worked for you so they can try out some new exercises, or maybe some of the exercises in this video that has helped. Thank you guys for watching. I'll see you again next time in the next video.